Vaccine confidence ang isa sa nakikita pong posibleng dahilan ng World Health Organization sa biglang pagdami po ng mga kaso ng COVID-19 na naitatala dito sa bansa araw-araw. Asahan ba natin ang pagsipa pa ng numero ng mga nahahawa sa sakit ngayon? Dumarami rin po ang bakunang dumarating sa Pilipinas. Para pag-usapan yan, we are joined by the WHO representative to the Philippines, Dr. Rabindra Abeyasinghe. Good morning, Dr. Rabi.
Good morning, Yusek Raki. Good to be here.
Dr. Rabi, can you tell us what vaccine confidence means and how it could possibly be the cause of the sudden surge of COVID-19 cases in the Philippines?
It's not vaccine confidence, it's vaccine optimism probably that is responsible to some extent to an increase of COVID cases, not only here in the Philippines, but in other countries also where we are seeing an increase. The interpretation is that with the arrival of vaccines, people started relaxing their protocol compliance, so the public health behaviors. There was a tendency, not largely, but in small measure, to go out more frequently, to meet more frequently with other people. Of course, this was partly because of the long quarantine periods and the long lockdowns that people have undergone. And so with the arrival of vaccines in many countries, there was an optimism that people can go back quickly to the way they lived life before the pandemic. And these little changes in compliance with the protocols is believed to have caused opportunity for the virus to transmit more freely, and that could have been one of the causes why we are seeing increased transmission here in the Philippines also.
Dr. Rabi, has the same scenario been observed in other countries that has started their vaccine rollout?
Yes, so we are seeing right now a global increase in cases. Our Director General mentioned that on Friday, that last week was the 4th consecutive week. We are seeing a week-on-week increase of the number of cases reported globally. So after a stabilization of transmission in January and early February, we have seen now that globally in several countries we are seeing an increase of transmission. And the thinking is that this could be related to vaccine optimism and the arrival of vaccines and not following the protocols and the physical distancing as before the vaccines arrived. But it could also be to some extent linked to circulation of new variants that are thought to have increased transmissibility. So the mix of these factors could actually be causing higher levels of transmission in the Philippines also.
Dr. Rabi, now that the FDA gave the green light to the Sputnik V vaccine from Russia, is this vaccine already included to the WHO's emergency use listing? If so, could the Philippines possibly get this from the COVAX facility on top of the AstraZeneca and Pfizer vaccines?
Unfortunately, the Sputnik V vaccine is not part of the WHO EUL process yet. It is a vaccine that is being considered by WHO for EUL listing because of its reported high efficacy, but the process is not yet complete, and so it cannot be included in the COVAX folder of vaccines until WHO grants emergency use listing status for the Sputnik V.
Dr. Rabi, with the issue circulating around the AstraZeneca vaccine that was suspected to have caused blood clotting in many countries in Europe has temporarily suspended its administration, while some continue despite this concern. Although WHO already mentioned that there is no evident link between the vaccine and the blood clot, is the WHO at least conducting further investigation on this matter to ease distrust and discomfort to this vaccine?
So there was some concern that there was a relationship between a few episodes of thromboembolic disease or blood clotting which had been observed in some countries of Europe. But we are happy to state that the European Medical Association, after a careful evaluation of all the data, has agreed with WHO's position that there doesn't seem a causal link with the AstraZeneca vaccine and the frequency of thromboembolic episodes that have been reported in the population. Actually, the number of thromboembolic episodes that have been reported in the vaccinated population was, according to some reports, lower than in the normal population. So there is no causal link established. And so we are conscious of the fact that there were about 40 cases of such disease episodes reported in Europe. But this is in comparison to almost 50 million doses of AstraZeneca that have been administered, nearly 20 million in Europe and about 30 million in other parts of the world. And these reports have not been seen anywhere. So based on this fact, WHO and now the European Medical Association reiterates that there is no link and it is safe to use the vaccines. Of course, recognizing that these are emergency use listed vaccines, WHO and the European Medical Association continue to say that national authorities need to monitor carefully for side effects, and we encourage countries using AstraZeneca vaccine to do that. The current position is that there is no evidence that the vaccines actually are causing those episodes, and therefore the usefulness of using the vaccine far outweigh these few sporadic cases that have been reported to WHO. So while advocating that countries continue to monitor for thromboembolic disease and other side effects, the consensus now is both from WHO and the European Medical Association that the AstraZeneca vaccines are safe for use. And based on this decision that came on Thursday from the EMA and Friday from WHO's Global Vaccine Advisory Committee on Vaccine Safety, many of the European countries that had a temporary halt on the use of AstraZeneca have restarted using them, and the AstraZeneca vaccines are now being used all over the world.
Dr. Rabi, do you agree with the government's move to administer the remaining AstraZeneca vaccine and stock as the first dose for health workers in areas with high cases of COVID-19?
So as the number of cases increase, it becomes critically important that we take steps to reduce that transmission, but also as part of that we ensure that the healthcare capacities are fully functional. Of course, it was with this view that originally the frontline healthcare workers were included in priority group 1, and now that we are seeing a surge of cases in the National Capital Region and adjoining regions, it becomes even more important that we protect the healthcare workers by the use of vaccines. So we are trying to maximize the benefit of the vaccines we have by vaccinating the frontline health workers as quickly as possible, targeting specifically those areas that we are seeing an increase of transmission. We know that with one dose of vaccine, there is protection of over 75%, and so it's important that we provide that protection to the healthcare workers so that they can continue to care for those people who fall sick from COVID in those areas of increased transmission. So this is quite aligned to what WHO, SAGE and WHO has been advocating, and we are happy that the Philippines is following this strategy. Thank you.
Dr. Rabi, what if the additional AstraZeneca vaccine did not arrive as planned in time for the health workers' second dose? Would this affect the efficacy of the vaccine?
The second dose is scheduled to be given after 8 weeks around and could be given up to 12 weeks. The evidence that is available globally shows that the maximum benefit of the second dose can be achieved by administering the dose after the 10th week and around the 12th week. So we believe that new stocks of AstraZeneca vaccine will arrive before the 12th week. 12 weeks from the arrival of vaccines on the 4th of March will be in June, and we believe that the country will receive further stocks of AstraZeneca before that, so that we can ensure that all those people, healthcare workers who receive the first dose, will be able to get their second dose before the 12th week or around that time.
Dr. Rabi, let's now proceed to the question from the media. We have here from Laila Salaveria. What does the WHO think of proposals to exclude PVT entities, such as those in the manufacture of tobacco, alcohol, milk, and soda, from procuring their own COVID vaccines? What effect could such a policy, if enforced, have on efforts to immunize the population?
The concern with those sectors procuring and distributing vaccines was that that could be used as advocacy for those products and could be interpreted from that light. So under the Framework Convention for Tobacco Control, which the Philippines has signed, there are limitations on providing opportunities for those industries to be providing health-related services or using health-related services for marketing advocacy. It's in line with this, we believe that the Department of Health does not encourage those industries to be involved in the distribution of vaccines. Of course, their workers will be entitled to vaccines through the national vaccine rollout. And so we don't believe that they will be left behind as the vaccine rollout happens.
We have another questions from Red Mendoza of Manila Times. Former National Task Force Advisor Dr. Tony Liachon criticized your statement in our previous conference, where you said that vaccine optimism was the reason why cases have increased in the country, stressing that the ultimate blame for the increase of cases in the country was the slow response of the government. What can you say about this?
Well, the fundamental reason is why are we seeing an increase, and as I mentioned the last time, this increase is not limited to the Philippines. We are seeing an increase in many countries, including in countries that have been rolling out vaccines rather successfully. So it's something larger than the slow response. The slow response could be attributed to increasing cases continuing, but the fundamental reason that actually contributed to an increase in cases is rather more likely to be linked to the factors I already mentioned.
Another question from Red Mendoza. With more than 21,000 cases posted in the past 3 days, is this a cause for alarm for the government to strengthen its response? Do you think the current measures that were imposed on Sunday are enough?
There are two aspects that need to be looked at. Clearly, the compliance with the minimum public health standards need to be reinforced, and those measures that were announced on Sunday will go a long distance to do that. But if we also assume that this transmission is in some way linked to the circulation of new variants who are reported to have increased transmissibility, it becomes increasingly important that at a local government level, we expedite the case detection, testing, the contact tracing, the quarantining and isolation of infected people and exposed people, close contacts. This aspect of the response is something that has suffered through the year because, as I've mentioned before, the implementation has been different across different local government units. So this is again an opportunity to reinforce and ensure that those measures are strengthened in addition to the non-pharmaceutical measures or the minimum public health standard that are being strengthened through the resolution of the IATA.
Dr. Rabi, a question from Joseph Morong of GMA News. If you analyze the present situation in the Philippines, what are the areas of improvement in the government's response to the pandemic?
So, as I already mentioned, the need to strengthen the rapid testing and strengthening the contact tracing and management, the identification of sources of infection. Where is the transmission actually happening? Is it limited to social gatherings in families or among friends? Is it also being driven by gatherings at work sites, in dormitories? This kind of investigation at local government level is critically important so that we identify those mass amplifying events and do everything possible to minimize the occurrence and the repeat occurrence of such situations. So this is an area that we have not been able to strengthen over the last few months, and maybe this is an opportunity for us to focus on that and identify those settings where we see transmission happening, and to share that information with the public so that the public can avoid those places and protect themselves more effectively.
From Summit Danilo of Business Mirror, has the WHO already conducted a study on the P3 variant of COVID-19, which was first detected in the Philippines? If yes, it is more infectious than the usual kind of COVID-19.
So the P3 variant appears to be linked to the P1 variant, which originally was reported from Manaus in Brazil, but with some further mutations. Now, the question is the P3 variant associated with increased transmissibility or increased severity of disease? WHO here in the Philippines and in other countries where the P3 variant has been confirmed is working with national authorities, including here in the DOH and the Philippine Genome Center. We are trying to understand the number of confirmed cases of P3 variants, what are their clinical symptoms, how many close contacts of them have been infected, because all this information will help us to come up with a hypothesis whether the P3 variant is actually linked to increased transmissibility or causing more severe disease. So this is an ongoing process. I would like to remind you that the B117 variant, which was originally detected in the UK in September last year, is still being analyzed, and we are trying to understand. So this process takes a long time. The P3 variant was confirmed only in early March, late February. So this is going to take a few more weeks or months to understand the epidemiological significance of the P3 variant and whether it is actually linked to increased transmissibility or severity of disease.
Dr. Rabi, from Joseph Morong, how soon do you think should the Philippines ramp up a vaccination to stern the rise in COVID cases and to stem the rise in COVID cases? And can the Philippines use Sputnik V for the senior citizens?
So vaccination is a critical component of the COVID response. We have repeatedly been saying that we want access to vaccines, equitable access to vaccines across the world, and especially more so in countries that are seeing an increase in transmission, because the impact of the vaccines will be far more marked if we can have populations in those places that are seeing increased transmission vaccinated. So in line with this, we are very much supportive of the Philippine government's efforts to access vaccines and provide protection to the population. This is, of course, in addition to the minimum public health standards that need to be reinforced. What we know is that if we can provide vaccines, particularly to the frontliners and the healthcare workers, we will see a marked decrease in severe COVID and a decrease in deaths. And this is our immediate aim. This is what we need to aim for now as we strengthen the minimum public health standards aimed at reducing transmission. So if we can access vaccines and provide them to the priority groups, we could expect to see that impact early on. So we encourage the Philippines to access vaccines as early as possible, and we certainly are working with the COVAXIN facility to expedite deliveries to the Philippines. With regards to the Sputnik V vaccine and whether they are suitable for elderly populations, I go back to the fact that this vaccine has not been completely evaluated by WHO at this point of time, and therefore I would refrain from commenting on that.
Thank you very much for your time, Dr. Rabindra Abeyasinghe, WHO representative to the Philippines. Thank you very much. Maraming salamat po.
Thank you so much. Have a good day.